Hey guys, Dr. Matt here back again for another Wellness Wednesday. Pretty excited to be shooting this Wellness Wednesday video for the first time in our new location. So we're really excited about this new space, which is fantastic and enables us to just better serve you guys. But this month, I'd like to take some time answering common questions that I get, especially about like home care. For example, common things that patients will ask me is, should I use heat or cold for these symptoms? What are your tips on sleeping positions or pillows? Or is it bad for me to adjust my own neck? Or if I turn my head like this and I get a crack, is that good? Is that bad? These are common things that I get asked often. So I'd like to look to address that, offer my 2 cents about it. Now, keep in mind, my disclaimer with this is each patient is unique, each case is unique. So I might give some kind of broad generalizations of when it might be appropriate to use heat versus cold, or when a certain pillow or bed type could be beneficial. But keep in mind, it's going to really vary, and we're going to have to customize it to fit the patient depending on their needs. So please take note of that and know that this isn't specific for each and every person. So today I would like to talk about heat. So when we utilize heat, what we're doing is really increasing the circulation in our body. So we're opening those blood vessels to get more blood flow to the soft tissues that are symptomatic. And what this can do is provide some pain relief. It can also help to decrease stiffness, which in return is going to increase our flexibility and also help with our range of motion. Common questions I get regarding heat at home is, how long should I be using the heat? And what's the best way to administer that heat? Because not everybody has a hot blanket or a hot pack per se, but you don't really need those things. All you need simply is an old tube sock. And what you do with that sock is fill it with rice, tie off the loose end here, and then you can stick that in the microwave for a minute or 2 minutes, depending on your preference for heat. And when you take that out, be sure to put it underside of your arm, kind of check the heat. That should be comfortably warm, but not hot. But right there, you've got an easy, reusable, cheap homemade hot pack that you can use and pretty much apply it anywhere on the body. So that's an easy way to obtain the heat, but for how long? So what I like to advise for patients is to utilize about 15 to 20 minutes of heat application to the affected area. Okay, so we want to apply that maybe for 15 minutes, give it a break, maybe work through some of the exercises that you've been prescribed by your doctor, since now things are kind of feeling pretty good, maybe fairly loose. Then we want to utilize heat for 15-20 minutes, give it a break for 15-20, then we could look to reapply that for another 15-20 minutes. Some things you want to keep in mind regarding heat is we don't want to just sit on that or fall asleep on it and have that stay in one area for longer than that 20 minutes. Because what can happen is, 1, we don't want to burn ourselves, and 2, we don't want edema to begin. And edema is just the pooling of excess fluids in the soft tissue. That just increases our risk for infection, decreased blood circulation, or inflammation in that soft tissue. Another thing to keep in mind when using heat is I usually don't have patients use heat when the injury is new or acute, especially if it happened just 2 hours ago and it's really sharp and painful in your neck. I'm probably not going to recommend heat. Ice might be a more appropriate option at that time, but heat can be really good depending on, again, the situation. For once some of that initial acute pain, discomfort has come down, and now we feel those muscles start to stiffen up or make it difficult for us to get to a certain end range of motion. So I hope you found some of these tips helpful for you. Next week we'll look at the application of ice, and then also what it looks like to maybe use heat and ice in conjunction with one another. We are here to help you move better, feel better, be a better you. You guys have a great week. We'll see you next time.
Everybody's moving, everybody's moving, everybody's moving, 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 moving. Everybody's moving, everybody's moving, everybody's moving, 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 and stop.
I am now taking off my sock to utilize for the demonstration, and it is really uncomfortable for me to do so because I hate having a sweaty foot in a leather shoe. Just thought I'd let you know.